IgG4-related disease is a fibroinflammatory condition that is autoimmune in nature. IgG4-related disease is certainly under-recognized. I think, number one, that's because it's a recently described diagnosis. The second part of it is that it's a multi-system disorder and it's slow. It kind of progresses slowly in general. As a result, people sometimes see different doctors before it all comes together. The interesting thing about IgG4-related disease is that it really presents in various ways. People can have, for instance, inflammation of glands or inflammation of lymph nodes, or they can have inflammation of the GI tract and even the liver and pancreas. I think that's part of the challenge of the condition is that it's not uniform and it can do many different things over time. It's really helpful looking at this condition and how it progresses. It may really inform us on some of the other rheumatologic conditions that we treat. Some of the key considerations when we're thinking about treating IgG4-related disease are what organ systems or what areas are being affected at that time. It's also important to recognize that this condition over time generally does flare up. And so even though you may treat it once, it generally does come back. We see that it tends to affect more than one organ system at a time. So it's very important to kind of treat this condition and have those thoughts as we move through the diagnostic paradigm. It's really important to treat IgG4-related disease that we have kind of a multi-system and multi-specialty approach. There are different specialties that will end up seeing these patients over time or at the beginning of the diagnosis. And so we have to have that connection as rheumatologists with other specialties. It both helps with diagnosis and with eventual treatment of the condition. There are some patients who it's very clear what the diagnosis is right at presentation. But in many cases, there's a clinical suspicion, and yet some of the clinical criteria we just can't fit those patients into. I do find that B-cell inhibition for this condition tends to be quite effective. On the other hand, there are patients who will not completely respond to those therapies, and so we need other medications that will kind of treat this condition long-term and then prevent those flare-ups. Here at Northwestern, in the Division of Rheumatology, I'm actually heading up a multidisciplinary group that will come together 2 to 3 times a year and discuss how we can better treat and manage these patients that have this condition.